am Dr. Venkatesh, Y, Senior Consultant Neurosurgeon, Sunshine Hospital, Secunderabad. Today I am going to talk about head injuries. What are head injuries? Any injury to the head is head injury. But actually, any injury to the head, also called as head injury, is a misnomer. Basically, when we say head injury, we mean the brain injury. So, also called as traumatic brain injury. Traumatic means there is some injury which is hitting the skull or the head and causing injury to the brain. So, nowadays we use a terminology called traumatic brain injury or TBI. Now, what are the different types of head injuries we have? We have got direct injury, indirect injury. We classify head injuries into direct injury, indirect injury. Direct injury means somebody takes a stick and hits on the head. That's a direct injury to the head. Indirect injury means somebody pushes a person, he falls down and hits the head onto the floor. That is indirect injury. That means the head is going and hitting the wall or the floor is indirect injury. Something like a heavy object comes and hits on the head, it's a direct injury. Apart from that, we classify head injuries or also the traumatic brain injuries into three types: mild head injury, moderate head injury, and severe head injury. Mild head injury is a head injury where the patient has an injury, the person has an injury, but he doesn't have any major problems like unconsciousness, ear, nose bleeding, or even fits. So this is a minor head injury where he doesn't lose consciousness, or even if he has lost consciousness, within a few minutes he regains that consciousness. The second type of head injury is a moderate head injury where the person has a prolonged unconsciousness, maybe for a few hours, sometimes a few days also, but he improves almost to normalcy. A severe head injury is where the injury to the brain is too significant, too severe, and he'll be in altered consciousness for a very long time, maybe sometimes weeks, months, and he may not improve completely to a normalcy. So this is grossly classifying head injuries into mild, moderate, and severe. Having said that, there is no difference between a mild head injury, moderate head injury, or a severe head injury when we are talking about the after effects of the head injury. Even in a mild head injury also, the patient can suffer from headaches intermittently, he can suffer from memory disturbances, he can suffer from behavioral disturbances like that, psychological disturbances, difficulty to do work, difficulty to concentrate. There are so many other things that can happen with a mild head injury. Moderate head injuries also, whatever happens in mild head injuries will also happen in moderate head injuries, plus there will be some other problems. Like patient may have some kind of weakness to hold a pen, difficulty to walk or something like that. In a severe head injury, there is significant brain damage and many times they may not improve to a normal functionality, though some of them can become independent. So what is the treatment for this head injuries and when will the patient come to us and what we are going to do about it? So whenever there is a head injury, the patient has fallen unconscious on the roadside, maybe with a bike accident or maybe in a bus accident or whatever accidents, accidental fall or while playing. So whenever there is an injury to the head and patient has fallen unconscious, immediately the bystanders, people who are around him will bring the patient to the hospital. If the patient has lost consciousness for a few minutes and then he regains completely, in spite of that, the patient has to be again thoroughly worked up and we have to do a CT scan to the brain and see if there is any bleeding inside, because sometimes there is something called a lucid interval. The person will meet with an accident, he will become unconscious, then he regains the consciousness because as soon as there is an injury to the head, the brain will go into a short period of shock and then it regains. But later what happens is bleeding inside which has increased and compressed in the brain and again he becomes unconscious. So these kind of things happen in what is called as extradural hematomas, which may require surgery to be evacuated, removed from the compression on the brain. So when the patient comes to us, we ask them four important things. These are called the red flags for head injury. One is, has he lost consciousness and for how long, or is he still unconscious after reaching the hospital? So level of consciousness, whether he lost consciousness at the time of injury and how long he was unconscious and has he become better after that, or he continues to be unconscious. That is one. Second is whether there was an ear and nose bleed. That suggests sometimes the skull base injury, the injury to this base of the skull, and that is also a red flag sign. It's dangerous. Many people know that whenever there is an ear bleed after a head injury, it is dangerous and people know that, and they bring the patient to the hospital. Third is whether the patient had any fits. That's also important. So after the injury, there is a fits. That means there is a significant injury to the brain. Now these are all and vomitings. After the head injury, if there are vomitings, that is also very significant. If these four things are there, loss of consciousness, after that regaining the consciousness or not, that is one. Getting fits, getting nose and ear bleeds, and fits and vomitings. If these are there, then we have to admit the patient in the hospital and we have to take a CT scan to rule out any intracranial injury, whether there is any bleeding inside or there is any contusion to the brain and such things. So after the CT scan is done, we come to know what is the status of the injury to the brain. So if there is a hemorrhage inside, but it is a small hemorrhage, we may do what is called conservative management. If it is a big hemorrhage, we may have to do surgery and remove the clot because it will damage the surrounding brain. So that's why we have to do that. Now, any patient who comes with a head injury, first we classify them into mild, moderate, and severe depending on what is called a Glasgow Coma scale. The Glasgow Coma scale tells us whether the patient is fully conscious, partly conscious, semi-conscious, or comatose. There is a gradation. We call call it as GCS 3 to 5, 3 to 15. People who are completely comatose, their score is 3. People who are fully conscious, the score is 15. In between 3 to 15, there are a lot of other scores. Any score less than 7 is quite dangerous. In such a patient, we have to do what is called as intubation. We put a tube into the mouth and into the larynx and into the windpipe, and then we connect the patient to the ventilator. The second level is 8 to 11 or 8 to 12. This is a moderate head injury, wherein the chances of recovery are much better compared to the patient who is between 3 to 7 score. And here also sometimes they may need a ventilator support. The third 12 to 15 scores, they are called a mild head injuries, and these people have a much better chance for survival and recovery. So patients who are having less than 7 GCS or Glasgow Coma scale have a serious head injury, and on evaluation, if you find some hemorrhages inside which are compressing on the brain or causing more damage to the brain, then we have to remove those hemorrhages, hematomas, and we can give a chance for survival. And in such patients, even though they survive, they'll have a lot of other problems, because whenever a part of the brain is damaged, that part of the brain does not regenerate. So, but the brain has a very systematic way of improvement. So, whatever the normal brain which is surviving, that part of the brain which is damaged, that function of the brain which is damaged, that function will be learned by the normal brain which is preserved. So, basically, the treatment of brain injuries or traumatic brain injury is to preserve as much function as possible. So, at the same time, to reduce the mortality and morbidity of the patient. So, in severe head injuries, sometimes once we remove the hemorrhages, then brain starts improving over a period of time. Sometimes 3 months, sometimes 6 months it may take, and some aspects of the brain functioning will improve, some aspects may not improve. So, then what is the long-term prognosis of head injuries? We have to give anticonvulsant therapy for all serious injuries, because there are chances that they develop fits very repeatedly. So, to prevent fits, we give prophylactic anticonvulsant therapy, and then there is a long prolonged rehabilitation for these patients. Many times it may take a few months to sometimes years, and sometimes even lifelong for those patients who are sometimes bedridden and in vegetative state. That's why whenever somebody asks me what is the best treatment for head injuries, my answer is prevention. Once there is a head injury, whether it's a minor head injury or a very severe head injury or a moderate head injury, there are going to be problems lifelong. As I already told you, the minor head injuries also can cause frequent headaches, then problems like fits, sometimes behavioral changes and psychological changes, difficulty in thinking, difficulty in concentration. There's so many things which can happen even in minor head injuries. Therefore, what is the best treatment? We have to prevent it. What are preventive measures? We all know that when we are driving in a bike, we wear a helmet, a good quality helmet, to prevent any untoward damage to the brain if there is by chance there is a fall or something like that. And prevention definitely is the most important thing. By preventing head injuries only, we can reduce all the morbidity and also the deaths that occur after injuries, road traffic accidents. Thank you.